Distribution of the children's COVID vaccine is underway across the country. The vaccine rollout for kids ages 5 to 11 got started Wednesday after the CDC director signed off on the vaccination recommendation this week, paving the way for millions of children to get vaccinated against the virus. Pediatricians, children's hospitals, vaccine clinics across the country are working to get up to full speed. So joining us to go over how the first few days of the rollout's going so far, Akron Children's Hospital Chief Quality Officer Dr. Michael Bigham. Thank you for joining us this morning, Doctor.
Thank you. Good morning.
Good morning. So, the initial rollout for this age group got started this week at your community vaccination clinic sites. So do you have any initial numbers indicating whether parents are really eager for this opportunity to get their younger kids vaccinated with the shot?
Yeah, absolutely. In fact, I'm at one of our vaccine clinics this morning at the Akron campus, and we have between 250 and 300 people signed up. I think we have about 250 signed up. We're expecting probably to deliver around 300 vaccines today, and then between the Akron campus and the Mahoning Valley campus over the next 3 weeks, we expect just in those community vaccination clinics, we'll likely give several thousand vaccines.
Wow, that's a lot. So parents are eager to do this. By the middle of the month, you're going to expand your access to the vaccine for the age groups. Where will you begin making this shot available in the next few weeks, and how can students be able to get these shots, maybe even at schools?
Sure, absolutely. So we really feel like we want to make as many options available to children and their caregivers to get access to the vaccine. So first, we already talked about our community vaccine clinics, both on the Akron and Mahoning Valley campus. Second, we have a great partnership with over almost 40 school districts. Many of those school districts are willing and excited to offer school-based vaccine clinics. And so we're going to be delivering that well through the end of this calendar year in those schools where we have partnerships. And then we have over 35 primary care offices throughout Northeast Ohio, and we'll be offering vaccine appointments through those primary care clinics as well. And so we're excited to be able to offer multiple options.
Wow, sounds like you're going to be busy. You mentioned several thousand shots between the Akron and Mahoning campus. So I'm wondering, at the same time, you're probably fielding concerns from parents and a lot of questions before they decide to have their child sign up for the shot. What seems to be the biggest concern that you're hearing from parents, and how have you been able to answer those questions and really give them some reassurance?
Sure. So we're hearing questions about side effects. What we know about the early experience with this vaccine is that the side effects were mostly arm pain, and that was pretty temporary, not lasting more than a day or two. There were some circumstances of fever or chills, but those side effects were very short-lived. And so we're reassured by that side effect profile in this vaccine. And what they did when they studied this dose is they found the dose that gave the best immune response, sort of the desired effect of a vaccine, but the smallest side effects. And so they kept lowering the test dose until they found that sweet spot of the smallest amount of side effects with the biggest immune response, the biggest benefit. The other question that we're hearing is about long-term side effects. We've talked a little bit about those short-term side effects, but what are the long-term side effects? And the way vaccines work is they generate a big immune response, and then they're out of your system. And so it would be really unreasonable to think about long-term side effects of these vaccines when we're really able to see that big immune response right in the face of the vaccine, generates those temporary mild side effects, and then the vaccine's out of the system. I would say those are the two biggest concerns we're hearing.
All right, doctor, I'm a mom. I go to the park a lot, talk to a lot of moms, and I think the biggest conversations we're having is the concern about possibility for myocarditis, the inflammation of the heart. And then also I have a daughter. I think a lot of moms are worried about potential for, young girls to have this impact their cycle or, just their fertility. Is any of that true, or is that just way out of the realm of possibility at this point? Because I think that's where a lot of us are worried and anxious about this.
Sure. Let's talk about maybe those separately. So for the myocarditis question, that inflammation of the heart, this has been studied in the adults. And in fact, they did the first 5 to 11-year-old study that enrolled about 500 or 1,500 kids who got the trial vaccine. And then the FDA said, why don't you double that number to make sure that we don't see any of these myocarditis complications in this youngest age group? So they did. They doubled the trial, which extended the timeline, but over 3,000 kids got this Pfizer vaccine in that 5 to 11 age group, and there were no consequences of myocarditis. Nobody in that study group got myocarditis. Now, that's not to say that if we do these vaccines in a million kids or several million kids that we might not see that complication, but the complication should be quite rare. And I think the most important thing to think about is the consequence or the risk of vaccine with, the risk of myocarditis with COVID infection or with MISC, that post-COVID inflammatory response, is far greater than any potential risk of myocarditis associated with the vaccine. And so if the concern's myocarditis, the answer or solution should be get the vaccine, because that risk is much less in those that are vaccinated than it is those that have natural COVID infection or MISC, that post-COVID inflammatory response. Related to the fertility questions, there's just no evidence of this. It's just not plausible to think about this. There is certainly a big legend that's being perpetuated that's just not scientifically sound. We care so much about child health, and we would never advocate for something if we had any belief that this would have a consequence on a young woman's long-term fertility, and we would just never advocate for that. And I think the most important thing is to know that we believe in the vaccine, we believe in the science, and as a result, we believe that kids 5 to 11 should get this vaccine.
Well, thank you so much for answering all of our questions this morning. You know, a lot of parents are just wanting to know, and when we have these conversations and something so new, it's helpful to get, just all of this broken down for us. So thank you so much this morning, and sounds like you're going to be very busy. So good luck on your busy schedule with all these vaccinations. This is a major undertaking. Thank you for your time.
Thank you so much. I appreciate it.